What is eczema? Eczema is inflammation of the skin. This is where you get redness, swelling, juicy little blisters, open areas, or cracked and broken skin. There may also be lots of scaling. What causes eczema? Eczema can be caused by many different things, and in fact, there are many different types of eczema. It can be caused by things like something irritating touching your skin, or something that you're allergic to touching your skin. It can also be caused by inflammation inside your body that's presenting itself in the skin. There are many different types of eczema. Many people think first of atopic eczema or atopic dermatitis, which we often use shorthand as eczema. But there's irritant eczema, where your skin can be irritated by something it is touched by, and also allergic eczema, where your skin has an allergy to something that it touches. We also see something called seborrheic dermatitis or seborrheic eczema, where we think this is a combination of inflammation to a yeast that is present on the skin. The classic picture of eczema or atopic dermatitis, in this case, that we talk about would be babies that then develop this itchy, scaly rash in areas like the creases of the elbows and behind the knees, as well as the face and the neck. But we also know you can develop eczema of any type at any age, and that's why it's important to be seen and diagnosed. In people with richly pigmented skin, eczema sometimes looks a little bit different. And this is not just because the red character is a little harder to see. They often will have more follicular type eczema, where you get the itching and the scaling and the redness around each hair follicle instead of a big juicy plaque. The patches of eczema that we often see as being red may be a little more purplish, or if there's been a lot of scratching, gray looking, in people whose skin tans easily. Some of the challenges that people may face in getting a diagnosis of eczema in people with darker skin tones is because it may look a little bit differently than what the textbook may show. This is often because the skin looks more purple than red, and the scale may be more grayish. There's also a type of eczema that is common in people whose skin tans easily, which is called follicular eczema. This is where the spots that are itchy are all around the hair follicles in almost little dots. Picking up these subtleties, particularly if you're having a hard time with your skin, is the reason why it's important to see a certified dermatologist. What are the treatments for eczema? There are many types of eczema, so it's most important to get the right diagnosis first. You'd want to first see your primary care provider and then be referred to a certified dermatologist. We may give you pretty simple advice like avoidance of irritants like too much soap or friction. We may also tell you to avoid allergenic products. Many of these can be things like perfumes, preservatives, or nickel. We then may offer you treatments like topical creams that help modulate the immune system, or pills by mouth or needles. We also use phototherapy, otherwise known as light therapy. Eczema is a chronic relapsing remitting disorder. What does that mean? It means you can get a big flare and then nothing. You can have little flares, or you can be a person who has eczema all of the time with flares that come in between. There are many different ways to treat eczema. Sometimes you're doing everything right. Moisturizing, avoiding the things you're not supposed to touch, but you get stressed or you get sick because life happens. In my practice, I like to give people a plan for what they use when they're having a flare. Talk to your doctor about creating a plan that works for you. It's important to remember that having a condition that impacts how you can sleep and how you function at work or at school, how much you can enjoy the things that you like to do in life, this is not just a skin condition. It's important to be seen and to be treated appropriately.